And councillors, we are live from River Valley.
Good morning. I will call the February 7th meeting of the Community and Public Services Committee to order and start by acknowledging that we meet today on the traditional land of Treaty 6 territory and acknowledge the diverse Indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as the Cree, the Dene, the Saulteaux, the Blackfoot, the Nakota Sioux, as well as Métis and Inuit, and now settlers from around the world. Start with a roll call of committee members. First of all, Councillor Jans.
Good morning.
Good morning, Councillor Tang.
Good morning.
Good morning, Councillor Wright.
Good morning.
Good morning. We're joined by, in studio, Councillor Salvador.
Good morning.
Councillor Stevenson.
Good morning.
And I'm just looking for online participants. Councillor Knack.
Good morning.
Good morning. Councillor Rutherford.
Good morning.
Good morning, Councillor Rice.
Good morning.
Good morning, Councillor Principe.
Good morning.
And I think that's all that are joining us for the moment. I will take a motion for adoption of the agenda.
So moved.
Thank you. Please vote on adoption of the agenda.
With the addition of 7.2.
Oh, I'm sorry. Yeah, we better make sure we add that. So that's with the addition of item 7.2, possession, transportation, and sale of Oresin capsicum spray products. Please vote. I am a yes.
We have all the votes.
Please display the vote. And that is carried. And I'll just point out that that agenda includes time-specific items as part of the agenda. So report 7.1, effects of homelessness on the healthcare ecosystem, will be first up. And possession, transportation, and sale of Olerorsin capsicum. I'm going to figure that out by the end of the day. It will be time-specific by at 1:30. I'll take a motion for approval of the minutes of the last meeting.
I move approval of the minutes from January 16th, 2023, Community and Public Services Committee.
Thank you. Please vote. I'm a yes.
We have all the votes.
Please display the vote. And that is carried. Are there any protocol items this morning? Not aware of any. So we'll move to selection of items for debate.
I can't click on, but happy to select a few things.
Okay.
7.1 and 7.3. Yeah, that's.
Thank you. Councillor Wright.
I'll select 7.2.
Any other selections? I'm just checking chats in case anybody. Go ahead, Councillor Tang.
Yeah, you know what? I'll just add 7.4 to that as well. Thank you.
7.4. Okay. Then I'll take a motion to move all other items.
So moved. It's 7. Oh no, 5.1, 5.2, and 7.5.
Thank you. Please vote on approval of those items. I'm a yes.
We have 4 votes.
Please display the vote. And those items are carried. Madam Clerk, would you please just summarize what we've approved so far today?
Yes, thank you, thank you, Chair Cartmel. This morning, Community and Public Services Committee has passed the recommendations of the following reports without debate. 5.1, new program with bylaw adjustments, development of a derelict residential class with a revised due date of March 20th, 2023. 5.2, lived experience and shared perspective standing committees with a revised due date of to be determined. And item 7.5, flood mitigation storage areas as snow dumps.
Great, thank you. So if anyone's here for specifically item 7.5, that's been approved without debate. So there's, you're welcome to stay, but there's no need to hang around. That takes us then to item 7.1. Pardon me, I better, sorry. Let me go through these items first of all, I'm sorry. Request to speak. Missed that.
Mr. Chair, I'd like to move that Community and Public Services Committee hear from the following speakers in panels when appropriate for 7.1, Effects of Homelessness on the Healthcare Ecosystem, verbal report. We have Punita McBrien, Edmonton Downtown Business Association, joining remotely. Tricia Smith, Radius Community Health and Healing, in person. Austin Farrell, HSAA Young Workers Committee, remote. And Bradley LaFortune, remote. Bradley LaFortune. 7.3, Anti-Racism Community Safety Fund Proposal Recommendation. Gary Puligandla from Canadian Mental Health Association Edmonton Region, joining remotely. Dunya Noor from African Canadian Civic Engagement Council, joining remotely. And Laura Cunningham-Spalley from Edmonton Federation of Community Leagues, joining remotely.
Thank you. Please vote on hearing from those speakers.
We have 4 votes.
Please display the vote. That is carried. Requests for specific times, we've covered that through approval of the agenda. Are there any councillor inquiries this morning? Not aware of any. That now takes us to item 7.1. So I guess we'll call our delegation forward. Good morning.
Good morning. We're here with you today to receive an update from Dr. Christopher Sikora, Lead Medical Officer of Health for the Edmonton Zone. At Council's request, Dr. Sikora will be providing an overview of the effects of homelessness on the healthcare ecosystem. Joining Dr. Sikora is Salan Tash, Executive Director, Community Health Services of Edmonton Zone, both with the Alberta Health Services. The health and well-being of our unhoused community has been and continues to be a key focus area for the City of Edmonton. Our previous efforts can be seen in the work of Recover, Edmonton's urban wellness plan, which utilized a number of prototypes as a way of collecting and learning about the city's investments in bridge and supportive housing. Since the onset of the pandemic and the dramatic increase in the needs in our community, our work has expanded to include additional investments in bridge housing and temporary emergency shelter, developing the emergency shelter standards and extreme weather protocols. The tangible impacts of these actions are winter warming buses, increased outreach, and safer pathways into housing. Also, we have focused on ongoing collaboration with other orders of government and community agencies. We'll continue to prioritize the health and safety for all, especially for those in our community that most need it. And we look forward to continuing and growing our relationship with the Alberta Health Services as we do that. And with that, I'd like to hand it over to Dr. Sikora to speak on the effects of homelessness on the healthcare ecosystem. Thank you, Dr. Sikora.
Well, thank you very much, and thank you very much for the opportunity to be here today. So what we intend to do is provide a brief outline on the impacts of homelessness or houselessness on our population and the broader healthcare ecosystem. So as we do that, we'll walk through some background data, both from a national, provincial, and ultimately local perspective. We'll look at activity underway and then highlight some possible future initiatives. Is there a next slide? Oh, I should be able to, okay, I can change, right? I can control, okay, no, you can control the deck, that's okay. Okay, so from a national context, we know that approximately 35,000 Canadians on any given night are homeless. About 250,000 experiencing homelessness in any given year. We have impact across the age spectrum, including in the seniors and the older adult population. We know that about a third of shelter population is Indigenous, and that's compared to about 4.3% of all Canadians that are Indigenous. We see a disproportionate impact for our Indigenous First Nations communities. Next slide.
So we know that the health outcomes for those who are homeless and houseless are poorer than the general population, and they fall into about three different categories. We see a number of physical health problems that are related to infectious disease, HIV, hepatitis, STIs, chronic diseases, injuries as a result of assault or brain injury, of course, exposure, so frostbite and hypothermia, nutritional deficiencies, and food and skin issues, or foot and skin issues. Mental health problems are very prevalent in the homeless and houseless population, with alcohol and drug dependence, elevated rates of cognitive impairment, personality disorders, psychotic illness, etc. And then, of course, substance misuse issues. We see acute toxicity, we see overdose that result in hospitalizations and unfortunately deaths, and then chronic exposure to harmful substances. Next slide. We also know that homelessness rates amongst gender diverse populations are at a higher rate and often at a younger age. And they often have difficulty accessing shelter spaces when needed, and they're more likely to sleep in a public place, which creates additional risk.
All right, next slide. So we also know that our homeless, houseless population has decreased life expectancy. So the average life expectancy of a homeless person in Canada is estimated to be about 39 years, and that's compared with average Albertan of around 81 years of age. Now, there are several provinces and cities do work with the coroner system, the medical examiner infrastructure, to collect mortality data on homeless populations. So, for example, our Ontario, Toronto colleagues, as well as British Columbia. At present, the data isn't easily accessible or identifiable. In Alberta, it's been probably about 10 years since our Alberta coroner has done a report on homelessness. And coroner isn't in the healthcare infrastructure, it's more in the Justice Solicitor General environment. It is managed at a provincial level, and since a report hasn't been recently published, it's difficult to comment on what this is, or at least what the life expectancy would be in Alberta proper. It is important to highlight that being homeless is a risk factor for so many downstream health effects: injury, assault, poisoning, amputations, frostbite, and placement of individuals into permanent supportive housing environments is certainly something that is highly protective against mortality. Also like to highlight that our School of Public Health and University of Alberta did do an injury. The Injury Centre did a good report on injury in homeless Albertans over 2019-2020 and identified that there were approximately 5,800 emergency visits across that year or that time span. The leading causes of admission and admission into an emergency department did mirror what we know from national data: high levels of poisonings, violence, falls, environmental related injuries, of which about 70% were cold related, and then suicide. Our next slide. Drug poisoning rates across Edmonton continue to be elevated, and this is data from Government of Alberta and the opiate dashboard. So we see the rate and count of opiate deaths in in Edmonton by month. We continue to see about 35 to 70 deaths per month within our city of Edmonton. We know that there is a geographic concentration of these poisonings and deaths in the central areas of our city, and that the poisonings are very common in our houseless, homeless population. Our next slide. Building upon local information from local partners, this is data from our Homeward Trust at the end of January, with identified 2,800 individuals that are experiencing homelessness. It's also important to highlight that 56% stated Indigenous identity. We have a predominance of males, about 63%. About a quarter of the individuals experiencing houselessness, homelessness, live outdoors. That does present an extra and enhanced risk for all those outcomes that we've previously described. Our next slide. Now this is some very specific local information. So for a 3-year time period, we were able to identify a cohort of individuals that we know that utilize shelter populations in the city of Edmonton. We were able to describe their age, and their age distribution is indicated on that top graph, with most in the, bad eyesight here, 35 to 40 and 40 to 50 age groups overall. Amongst this subset, the subset comprised 1,129 individuals, and so it's a subset of those that are identified as utilizing shelter populations overall, but we were able to identify and track what health conditions, broad health conditions they have, and how they utilize the healthcare infrastructure. So the common health conditions that we list here being drug and alcohol dependence in about 80% of those individuals, just over half having skin infection or contusion or skin injury, about half having joint or tendon disorder, about half experiencing over the course of that 3-year time period poisoning or other adverse effect, and just over a third having open wounds, and about a third having pneumonia. Our next, and I guess just to also supplement this, our trauma data also supports that about 4% of total traumas would be amongst individuals of no fixed address, which does comprise an elevated amount of trauma as well, which also mirrors what's seen from our injury reports, and also mirrors what's seen from our national data. Next slide. Building on our local data, so the presence of this illness does result in a great deal of healthcare utilization. So in that same subset of 1,100 individuals over that 3-year time span, you can state that 518 individuals used the emergency department between 1 and 10 times each, while 95 utilized the emergency department over 51 times each. 191 individuals had between 5 and 46 hospital admissions over that 3-year span, with 555 having between 1 and 4 admissions each. It highlights that individuals who are underhoused do utilize both emergency and inpatient resources a fair bit. Our next slide. And just to also describe other circumstances within the city of Edmonton, as well as the outcomes of being houseless and homeless. We are in the midst of working through an outbreak of Shigella within our inner city environment. So as of late January, we have just over 200 confirmed cases with an average age of 43. About 2/3 are male. 2/3 have needed and required hospitalization. The hospitalization actually represents just over 900 bed days. And I think I'd like to also just take this opportunity to thank the City of Edmonton for their extremely helpful partnership during the Shigella response. I do strongly believe that the hygiene resources and hubs as a means to decrease transmission have been very much helping. Our next slide. When we look at possible solutions, we often refer to a housing first approach. And you know, we've described a lot of the bad outcomes that can come from being houseless or homeless. So this is a high-level outcome evaluation of a handful of individuals who were successfully housed in a permanent supportive housing option. So it's a comparison of 2 years before being housed to 2 years after being housed. We noted that after being housed, there was a 58% drop in the number of inpatient admissions, an 81% drop in the overall number of inpatient bed days, a 74% drop in the number of overall inpatient acute days, 45% drop in the number of emergency department visits, 31% drop in the overall number of EMS visits, and then a 68% drop in the number of noted addictions and mental health related EMS events. Housing works. Our next slide. Within our mental health structure, we do observe increase in complexity and pressures on the mental health care system. All mental health admissions are triaged in our emergency departments, and over the last 4-year time period, we do see a steady increase in the number of hospital admissions over that time, with 2018 showing about 4,600 admissions to 2021 showing about 6,000 admissions. Our next slide.
So AHS has got a number of activities underway to address the homeless and houseless population and their health needs. And I think probably the biggest takeaway message is, because of the complexity of this population, we have to do it in concert, in partnership with community agencies, municipalities in the Edmonton zone. But there are a few things that I'll highlight for you that we're doing. So in emergency department, we do have social workers that are working with those that show up in Emerge, and they need supports for transitional housing. They need supports for connecting to addiction and mental health. And we have a new initiative. It's in its infancy, a partnership with Jasper Place Wellness to provide some beds to those who need to be discharged from Emerge but can't be discharged to the street. And so it provides some transitional housing to ensure that they have some care and a safe place to land while stable housing is being arranged for them. We have a number of programs that support pregnancy to improve the health of pregnant women as well as health outcomes for their babies. We have a wonderful partnership with Radius Health. It's called Pregnancy Pathways, and we've provided housing. We don't provide housing. We work with our partners to support the medical needs in a housing complex, and we do that through Radius Health. Radius Health has been a key partner with us because they deliver services to this very complex population in a way that AHS cannot, and so they're a huge partner in the delivery of health services. We have a number of youth support programs and mental health programs, and I can't even start to speak about those. Lots and lots of work there. And I'll just highlight one other thing that we're doing around medical respite or creating a medical dorm. So one of the things we learned in COVID, it's one of the silver linings, we had a few, and we learned that the Edmonton Isolation Facility was a huge part of our taking care of our homeless and houseless during COVID and providing a safe place for individuals to land when they needed to isolate and when they needed to convalesce. What we realized is the need for medical respite didn't go away with COVID becoming endemic. It is something that we need to continue. So we are working closely with our Radius Health partner as well as a number of community agencies to find a space to create some beds so that we can provide this medical respite or a medical dormitory for convalescents. We're going to start small. It's going to only be about 10 beds to begin with, but really important in providing some of that support, that housing support in a very transitional way, but with the medical supports in place. Next slide.
We know that this is a multi-factor challenge. We know there's multiple ministries that are involved with this. We know that health, education, justice, addictions, all social supports are things that have a very important role to play in this challenge. We know that there are those upstream determinants of wellness, income, culture, gender, and personal factors that all impact health outcomes, and that solutions really are needed to improve our overall community environments to ensure that people can ultimately reach their full health potential. Next slide. So there's a defined need to be active in all three aspects of a solution. So prevention of homelessness is important, as many should be prevented from becoming homeless. Within our healthcare infrastructure, we commit to strengthening systems integration with community organizations, along with the highlighted need to discuss transitional components, for example, those shelters or other encampments. And I believe that there's a continued need to focus on the creation of permanent supportive housing options as part of this approach overall. Our next slide. So again, thank you very much for the opportunity to chat today. On behalf of Celine and myself, we do thank you for the chance to be here.
Thank you for your presentation. Appreciate you being here this morning. We'll now hear from our speakers. Committee structure is just a little bit different than your past attendance at our meetings to you both. So we'll hear from our registered speakers now, and I have on my list here, first of all, Panita McBrien. We're joining us remotely. Just make sure that Panita's with us. Not seeing her pop up. And second, I have Tricia Smith from Radius Community Health and Healing. So if you want to make your way forward. Third, I have Austin Farrow, who's joining us remotely, and Bradley LaFortune, who's joining us remotely. So we'll come to those speakers in order. So for our speakers, just a reminder that you each have 5 minutes to speak. For those joining us in the room today, there's